Hi, everyone. I'm Benjamin Peters, the director of the Global Scholars Program. And on behalf of our staff and our community members, I want to welcome you to GSP's fourth annual Global Citizenship in Practice event. This year, a webinar on global citizenship in the age of COVID-19. I'd like to begin our event with our land acknowledgement. The Global Scholars Program, like the University of Michigan, acknowledges the university's origins in a land grant from the Anishinaabe, including Ottawa, Ojibwe, and Bude-Wadomi, and from the Wyandot. And we further acknowledge that our university stands, like almost all property in the United States, on lands obtained generally in unconscionable ways from Indigenous people. Knowing where we are changes neither the past nor the present. However, through scholarship and pedagogy, we work to create a future in which the past is thoroughly understood and the present supports human flourishing and justice while enacting an ethic of care and compassion. I'd also like to express our gratitude to our sponsors and co-sponsors for today's events, the UM School of Public Health, the LSA International Institute, the Honors Program, Health Sciences Scholars Program, Michigan Community Scholars Program, Michigan Research and Discovery Scholars, and the Residential College. GSP hosts this annual event as an opportunity to share interdisciplinary approaches to global citizenship with emphasis on how we put this idea into practice. This year, thanks to the online format, we're pleased to welcome back 4 members of our GSP Alumnix Network, joining us from Mexico, South Africa, the United Arab Emirates, and the United States. Our co-hosts will introduce them in just a minute, but I want to mention that all 4 panelists are here in their personal capacities and not speaking on behalf of or representing their current employers. On a housekeeping note, we will be using the Q&A feature to advance questions to our panelists today. If that Q&A feature is not accessible to you, then please email your questions to globalscholars@umich.edu. Now I'd like to introduce our event co-hosts, both of whom are third-year members of GSP and who sit on our program's advisory council. They are Varsha Kumar, an LSA student in biophysics and a student of Ross Business Administration, and Amanda Teschner, an LSA student in sociology. Varsha and Amanda, thank you for co-hosting today.
Thank you so much, Benji. We're so excited to be here and we can't wait to have a great discussion. So we just, wanted to talk a little bit about this event and we're going to introduce our panelists. So this is a Global Citizenship in Practice conference. And so global citizenship is a really popular idea, yet we don't always conceptualize or actualize it in the same ways. So some of us argue that we're global citizens by virtue of our increasing interconnectedness with other people and cultures. Others identify as global citizens because of a sense of collective responsibility over a shared future worldwide, a responsibility which must be actively incorporated into our daily lives. And this feeling of responsibility can really stem from identifying with a multicultural background or a diverse set of experiences.
And the other portion of our panel today is the current state of affairs. We are over a year into the COVID-19 global health crisis, and the pandemic is highlighting ongoing global disparities and the urgency of a shared commitment to both human rights and global social justice. Today's event is meant to spotlight examples of global citizenship in practice in the age of COVID. So now we are going to introduce our panelists and thank them again so much for joining us today. One of our panelists is Moonmoon A. Khan, who grew up in Detroit, Michigan and graduated from the University of Michigan with a Master of Public Health and Certificate in Global Health and Bachelor of Arts in International Studies with a minor in Community Action and Social Change. She was an active student leader in the Global Scholars Program, Gates Millennial Scholars, Michigan Chapter, and CASC community. As a graduate student, she served on the UM SPH Student Assembly, and published the first research study on the impact of settlement on the health of Bangladeshi Americans in Hamtramck and Detroit, Michigan. Munmun started her career in federal service as a presidential management fellow at the Centers for Disease Control and Prevention in Atlanta, Georgia, where she currently works on health policy today. Her portfolio includes global health security, budget policy, and congressional relations. Some of her fondest college memories are the deep friendships built on the fourth floor of North Quad through late night debate and board games, #SoGSP, organizing the first GSP formal, an embassy affair, and hanging out for chai chatter in the GSP office.
Our next panelist is Ariana Perez Vincent. She is a proud Peruvian American who was born and raised in Washington, D.C. She earned her Master's of Public Health in Health Behavior and Health Education and her Bachelor of Arts in International Studies from the University of Michigan. As an undergraduate student, she spent a year studying abroad in Senegal and Thailand, and thanks to the International Institute, was able to do summer internships with local NGOs in Peru and India. She was lucky to spend a semester as a GSP student and rejoin the GSP community as a GSI during her master's program. After graduating, she moved to Pretoria, South Africa, to work at the CDC. Ariana works in the Epidemiology and Strategic Information Branch as a monitoring and evaluation fellow, where she's able to leverage both her passion for improving sexual health and her love of data to contribute to a data-driven HIV/AIDS prevention, treatment, and care program. Outside of work, she spends most of her free time dancing, camping, biking, and playing board games.
Our next panelist is Cache Colvard, who is a department administrator in clinical operations at the Cleveland Clinic, Abu Dhabi. In 2018, she completed an administrative fellowship at Cleveland Clinic after graduating from the University of Michigan with a Master's of Health Services Administration. In addition to receiving an MHSA, Cache also completed a Master's of Business Administration. In 2015, she received a bachelor's degree from the University of Michigan, where she majored in Asian Studies with a concentration in Chinese language and culture and minor in mathematics. At Michigan, Cache enjoyed her time in GSB, especially Shondaland, where she was a residence advisor. Cache has held board positions with the Midwest chapter of the American College of Healthcare Executives and currently serves in a board position with the National Association of Health Services Executives. As an emerging leader in healthcare, Cache wants to build a community rooted in equity, respect, and integrity. Ultimately, she wants to help create a broader platform for women and minorities in healthcare to achieve success and leadership within their organizations. If you'd like to learn more about Cache's background, please visit cachecolvard.com.
Our last panelist is Mayumi Kimura Meguro, and she is a Mexican-Japanese human rights specialist born in Mexico City, Mexico. She recently graduated with distinction from her master's degree in international relations at the London School of Economics and Political Science, concentrating her studies in human rights and gender. Mayumi graduated with honors from the University of Michigan in 2017 with 3 degrees in international studies, music composition and theory, and a minor in business administration. As an undergraduate student, she traveled with the Global Scholars Program as a teaching assistant for the study abroad course in India, UC 370, exploring educational disparities in India, also serving as GSP's resident advisor, peer facilitator, and a member of advisory council. Upon graduating, she completed an internship with the UN Office of the High Commissioner for Human Rights in New York, UN headquarters, where she worked reporting for the General Assembly's Third Committee and with the Equality and Non-Discrimination Unit. She is currently working for the UN Refugees as a field assistant, working on the field in Mexico's southern border, helping UNHCR monitor the migratory and refugee crisis at the border and providing humanitarian assistance to asylum seekers. Again, those are our fantastic panelists. We are so excited that they are with us today. We are really looking forward to talking with them. So the way that this panel is going to be structured is that we have some questions for all of you, and then we have some other questions that are for a specific few of you, and we hope that you will enjoy this discussion as much as we will. So transitioning into our first question, we were wondering if you could tell us something about your experience in the Global Scholars Program and how it impacted your personal, academic, and/or professional development.
I can start. So GSP for me was a great community to be involved in. I was involved as a student and then involved in terms of as a resident advisor as well. And it's really a family and a support system for many people. And I can say I had some of the toughest conversations and was challenged the most when it came to my belief system, understanding about different cultures and identities. And I feel like that really prepared me, especially being in a professional space now where there aren't many people like me. It helped me understand how to have tough conversations with people. And also gave me the confidence to be able to discuss DE&I issues in spaces that previously haven't engaged in those conversations in a robust way. And it also helped prepare me for the international journeys that I've had since then. You know, learning about different cultures and foods and celebrations. I feel like we had that all the time at within GSP, and it was nice to have those types of experiences to help, you know, give me just experience and understanding before transitioning into some of those spaces myself.
I can go next. Well, first of all, thank you so much for having me here. Being reconnected with the GSP community, it's always re-energizing and it always fills my cup right up. So usually every year I make a pit stop to the GSP office and see everyone. And this pandemic has definitely added a barrier to that. But like Cache, GSP was really my anchor on campus. It was home. It is where I developed the deepest friendships, going through the world events that were happening in 2010, 2011, all around the world, and having friends whose family was there and being able to hear firsthand what is happening and how changes in democracy, what that meant, instead of the headlines, just hearing it from personal experiences. It really solidified for me that during the opening, we were talking about what does global citizenship mean? And I would say it's more so the latter, that everything we do impacts someone else and impacts the larger global community. So this really was defined for me in the GSP community. I was saying before this call started, I think I'm the longest residing person from North Quad. I moved in when GSP went into that North Quad building, and I stayed on during my victory lap, my 5th year. So 4 really great years there. And yeah, it's the perspective and really shaped who I am as a person.
Hi, I can go next. I think what impacted me the most from my time as a student and as a GSI with GSP is really the sense of community that's intentionally built and fostered every day. It's one of those things that you don't realize is so incredibly special until you leave. And it's really been on my mind lately because I've been thinking a lot about the importance of community and how to build a sense of belonging for myself and others during COVID and post-COVID. And I realized that GSP does 2 things in particular that I try to bring into my personal and professional life. The first is its focus on building personal relationships. I know that seems simple, but I love that GSP provided such a structured and unstructured space for students to connect and learn about each other as people first. And I firmly believe that there's no better way to build compassion and connection than to really get to know people in your community. So I try to do that wherever I go. And then the second is having a growth mindset. Something that GSP does really well, in my opinion, is creating a space that acknowledges that everybody is learning, and it creates a safe space for dialogue, for conversation, and for self-reflection. And in the workplace especially, I didn't realize this would be so hard, but I really try to challenge myself first and foremost to try to build this space and to enter it as my most authentic and vulnerable self, so that others can hopefully feel like they can do the same.
Hi, thank you also for inviting us. I'm so excited to be back here. And for me, kind of the same as everybody else, like GSP was just my anchor in college. It really was like the catalyst of all personal and academic growth that I continue to see even nowadays, every day on my personal and professional life. As an international student, particularly, like it proved a home away from home for me, where I was able to basically create a family from all over the world who I continue to be in contact with. And they're kind of like Moon said, they're still kind of also some of my closest friends in the family and people that I rely on everything, really, because you know that you've had these tough conversations on all kinds of issues, and you are able to create a nurturing environment where we all grew for 1, 2, 3, 4 years, even through so many experiences in college and living together and being in North Coed playing board games, or in the dining hall, just like stuffing ourselves with food and everything. It just created this like really special community where I was able to feel safe and nurtured, but also very challenged. And I feel like I continue to have those experiences that I learned from GSP even nowadays.
Thank you so much for all of your wonderful answers to that question. I just want to also send out a reminder to the viewers. You are able to submit a question to the Q&A function at any time, and so then we will get to those after our planned questions. So if you think of anything, feel free to pop it in there. So our next question for all our panelists is, how has the pandemic affected you, your work, and the communities that you support through your work?
Yeah, I can go first. I'll say it has impacted everything in every way. I will say first, as a person, as an individual, it has really, I think this pandemic has really blown up the inequality that we have in our society and the world, and just grappling with seeing every inequality play out, and it was just overwhelming. So I think this has made me really question like what does it mean to be a responsible community member, a caring neighbor, a child to a parent, to explain what we should do and should not do at a personal level. But even as a public health professional, it has, in a scary way, really shown how intersected every sector of our life, from the community level to the policy level, impacts a person's literal livelihood and survival. And it has really, on one hand, like driven me to reconfirm my passion for public health and why I'm in this field to address these challenges. And another part, at times feeling like we will never solve the issues. There's so much happening. It's overwhelming. But in a bigger way, the optimist in me, the whisper has gotten louder and louder that this is the big shakeup and we will come out of this better. I did go through the first few months of this pandemic and like, we're never gonna get out of this. It's only gonna be awful, to okay, we're a year in, there's lessons we learned, there's things that I can do as an individual, there's things that we as a community can do and we can get out of. So from the professional lens, it has re-solidified my purpose in being in public health and at the federal level. But on a personal level, it has reconfirmed why we need to push harder to address the inequalities in our society. There is no reason why, like we learned in graduate school, sometimes your zip code has a greater impact on your quality of life than your own genetics do. And there's no reason why this shakeup should not prevent us, to keep us from addressing those inequalities that we see. So in a nutshell, it has been a huge shakeup, and just reconfigured the purpose of what I'm doing and why I'm doing it.
The pandemic, for me, as for many of you, I'm sure, has made me feel very isolated. Being here by myself, away from my family for a year, was honestly the longest time that I hadn't seen my family, and it was tough. Our country was completely shut down. No one allowed in or out unless it was a true emergency. So I kind of felt in this weird bubble, if you will, for about 8 months, and it was an interesting experience to have, especially having friends come and go. It's a very transient population already, so having to cope with that as well as with the pandemic as well. And I'll say from the work aspect, being in the provider space at a hospital was super trying. We didn't really have the opportunity to work from home. We were at the hospital all the time. So we had to figure out how to, protect our patients as well as protect our caregivers who are on site. At one point, we went from seeing anywhere from 200 patients in our ED to well over 1,000. So thinking about caregiver burnout as well was something that, wellness is always a part of taking care of our caregivers and our organization, but became especially important during the pandemic because we had the same amount of people, oftentimes less, taking care of more patients, more critically sick patients. And it was very trying, while wearing full PPE for hours on end. So that it was a difficult time to be in, and we're still in that, going over this last hump, hopefully, and now that vaccinations are out, we hope that, we've gone through the rough part, but it's been a trying experience. And I think for the community as well, especially here in the Middle East, being on lockdown during celebrations like Eid is very tough. And how do we continue to take care of people and think about their social and mental health while also keeping them safe? So it's been just an extremely interesting experience. And I think, like was said already, we hope that we take learnings from this, so that history doesn't repeat itself, and that we think about ways that we can incorporate what we've done so far into life after the pandemic.
I can go next. Personally, the pandemic, kind of like everyone, it's changed everything. I actually was during my master's that the pandemic started. So in the middle of being in London, I had to pack my things in 2 days and go to Mexico to be with my family. Otherwise, I would never be able to get out of there. And other than that, the pandemic really changed my perspective in things in life, as things that I took for granted. For example, my health, my family, and my friends. We've all lost a lot of loved ones, so those kinds of things that the pandemic has taught us, I think, were the things that have really affected me and have really made me appreciate the people I have in my life, and the privilege also that I have, also like being aware of that privilege that I have of being able to take a plane or being able to access healthcare or something. It has really made me rethink about all the things that we all take for granted, really. And in terms of my work for UNHCR, it really changed everything. I actually was very lucky because I actually got this job in the middle of the pandemic in August. And I began my work also in the middle of the pandemic. So I actually don't know what UNHCR's work was before the pandemic. I just came in like right in the middle. And I just know they had to adapt. So the way that we had to reach our persons of concern, the way that our whole operation had to work had to continue, because kind of the same as in the other panelists in healthcare, the pandemic doesn't stop for refugees or the context that makes refugees run away from their country. So UNHCR at least has had to really figure out how to make our whole mandate work. And that has been really interesting. Yeah.
Just to follow up on what Mayumi just said in terms of the pandemic not stopping for refugees, or from my perspective, working in HIV, it's not stopping for people either on treatment for HIV. It's really important to maintain people on treatment so that they can lower their viral loads. If they lower their viral loads, people can live really long and healthy lives. And it's a form of prevention, because if people are in treatment, they're not spreading the virus. So the impact of the pandemic has been really, really, really hard. People couldn't go to their facilities to get medication. So there's been a lot of interruptions on treatment. Obviously, there's lowered, number of people getting tested. In South Africa, I think it's about 18% of the population is living with HIV. And a lot of people don't know their status. So we really push to get everybody that is HIV positive to know their status and on treatment. So it's been really challenging in the health sector at the facility level, doctors getting sick, people really risking their lives every day, even simple things that I wouldn't even have considered of, we need to track how many people are on treatment. That requires, patient files that need to be entered into a system. That means that all the data capturers need to go. They're also risking their lives every day. And it's just been really, really hard to see. And even after the lockdown, it's really scary. People have moved. They're too afraid to go to facilities. But I do want to touch on one really positive thing, which is because we want to decongest the facilities, it's been really incredible because the National Department of Health is really pushing to get people the ability to pick up their medication at a pharmacy, which, is not the case usually. They actually they have to stand in line, wait for hours, go to talk to a doctor every month or, every 2 months. So really pushing to get people the ability to pick up their medication elsewhere in the community, delivery services, combining, integrating services, COVID testing with TB and HIV services. So it's been great to see those kind of positive aspects coming out. But in the end, it's, we all just have to keep working hard and also recognize that people are trying as hard as they can, especially people on the ground. And then also to touch on the sense of being overwhelmed, I've been balancing between telling myself like, okay, it's okay that I'm not doing okay today. And then some days I'm feeling so joyful and happy and great, and I feel guilty about it. And so I've been really reckoning with that guilt. And I think one of my main takeaways of the pandemic is like the importance of prioritizing joy and rest, and that's not only okay, but really great. It's the more joy and rest you get, the more joy and impact you can make. So that's been really good. And then the last thing I'll say is, again, like the other panelists, of just practicing gratitude every day, and realizing my privilege and doing the best that I can to make some sort of difference. I know it seems everything is important, even if it's small. I'll end with that. Thanks.
Yeah, thank you all so much for sharing. That was really insightful. This is a question for Ariana and Cache. You guys maybe touched on this a little bit, but we were kind of wondering, like, how your experiences in a high income country like the US, where there's this like established healthcare system in some ways, like how have your experiences seeing that affected your ability to navigate the unique challenges of the community where you currently serve?
I can start. So coming from a high income country like the US has honestly made me really aware of the importance of keeping inequities and injustices at the forefront of my mind. Coming from the US, I know that regardless of how, wealthy a country is, it's really, really important to never forget that there are still enormous gaps in reaching vulnerable and marginalized communities everywhere within the US and in South Africa, in the entire world. So I'm always thinking about that. And then also coming from the US, I'm really aware of racial health disparities that exist. In the US, the Black population is more affected by every single disease. And in South Africa, there are so many unique challenges around race, especially due to the legacy of apartheid, which only recently ended 24 years ago. So, but in terms of navigating, I would say that I try to take the same approach that I would working in a community in the US, which is really focusing on listening. No matter where I'm working or what I'm working on, I just try to be a sponge. I just try to be a sponge every single day. I just try to ask as many questions as I can. I try to go on as many field visits. I try to always consult and work closely with the locally employed staff because I know that they're the ones that know the context. They're the ones that have been working here for living and working here their entire lives, where as the US employed staff are only here, 2 to 5 years, and then they cycle out. So there's just so much knowledge that we can get from them. And then lastly, I wanted to say that I really believe in honoring the slogan, nothing with us without us, which I believe came into use in the US in disability activism. And it's been really amazing to see how HIV advocates have really taken that on and tried to put civil society and voices of people living with HIV at the front. But at the same time, it's just not done enough. And it's one of those things that needs to be intentionally advocated for and practiced throughout, every single day, every single meeting, every single policy, every single program. So yeah, I'll end with that. Thanks.
So I think my answer is twofold and kind of on opposite ends of the spectrum. So Cleveland Clinic was brought here because the leader of the UAE at the time received care at our facility and wanted to institute that level of care and patient experience and accessible healthcare to the people of this country. So in many ways, and then I'll share too, prior to Cleveland Clinic getting here in the UAE, heart care was the number one reason patients were leaving the country to seek international care. And now it's like number 35 or 25 on the list. And at the moment, cancer care is one of the top reasons that Emiratis are seeking medical tourism. And we're building a cancer facility with international renowned, surgeons and the, most advanced equipment. And so in many ways, without the level of care and quality that the US has helped, or Western medicine in general, has helped develop, this country wouldn't have that access to care that they do now. So I think that's one of the things that I'm grateful for, to be able to come here and provide care for this community within their community, and also with the level of focus of training Emiratis to be healthcare administrators and to be practitioners, so that one day, it isn't expats leading the organization, it's all, members from the community leading this place. And then on the opposite end, one thing that I've always been cognizant of is spending too much time at international places, because whenever I want to go back to the US, they can question, I don't know the policies, I don't know the healthcare landscape, you've been abroad too long. So for a long time, I was hyper focused on, I need to get back within enough time that people can trust that I have the skills and the knowledge to be an effective leader in the US. However, seeing the pandemic unfold and all of the challenges that the US has faced and how different this country has managed the pandemic, I know that I have more than enough experience to bring back to the US to help us make decisions better. And I think we, at times, and people here, view the US as the end all be all for quality care. And that's the go-to, and in certain ways, yes, but in other ways, we have a lot to learn from other countries in ways that we can provide care better. And insurance is just one of them, but so many others, and definitely crisis management, and how politics and governance and policies impact that as well. So it's been an interesting experience being from the US, especially in the UAE, because it's a completely stark contrast in so many areas, but has definitely allowed me to take away some key learnings from this experience.
Thank you so much for your responses. This next question is for Mayumi. How are the shelters working despite the pandemic, and what prevention measures are being taken to slow the spread of COVID-19?
I'm sorry, I think my internet connection is really unstable, so let me know if you can't hear me. But as I've said, the context of COVID in shelters and refugees has been very, very grave. In terms of shelters, just to put you in context, one of the tasks and responsibilities that I have to do is just manage the communication and just handle, just see that shelters are also being able to provide the dignified and safe place for refugees, as they are not shelters that are owned by UNHCR, but we do lead a lot of communication with them. So in terms of shelters, a lot of shelters have actually had to close because of COVID-19. But the shelters that continue to be open have become extremely essential in our mandate, in UNHCR mandate, to continue to ensure international protection for these uprooted people worldwide. And moreover, to provide a dignified and safe context for these people who are seeking asylum outside of their country of origin. So some of the things that the shelters have done, if they have closed, is continue to provide food, legal counseling. Some of them even have doctors have been able to provide some medical care. And if not, some of them have actually continued to provide shelter, and they have, as I said, they are extremely essential. And for that, we have donated, from part of UNHCR, donated a ton of stuff, including alcohol, cleaning supplies, everything, but also training on proper healthcare measures, and also constant monitoring to continue to see that the healthcare measures are being kept. And yeah, sorry. Yeah, other than that, it's been a challenge because, as I mentioned, the shelters are organizations run outside of UNHCR, so it has been a bit of a challenge sometimes to be able to monitor and keep control of all these health measures that are being followed where the people are having to stay. But so far, it's actually proven essential work that refugees have to rely upon in order to not be left on the streets as they continue to seek asylum and refugee status.
Yeah, thank you so much, Mayumi. That was really insightful. This next question is for Moon. So we were just curious as to like what are some of the challenges that local care providers face in delivering COVID care, including vaccinations, effectively, like in terms of like changes in their supply and then the logistics of distributing them, et cetera.
Yeah, that's really a great question. I think a lot of the challenges that we're seeing today, we're one of the few high-income countries where our public health system is separate from our healthcare system. Early on, we saw lots of issues with just even data, like how are keeping track of cases and alerting and communicating across states and cities and from all angles of the government and sectors. This pandemic has really shown what lack of investment in public health systems really shows in our healthcare system. I remember when I was in graduate school and the Flint water crisis occurred, and that was a huge wake-up call of like, this is a basic access to clean, safe drinking water is something an hour away from Ann Arbor we were seeing. And this pandemic has really shown how distinct and different, and in many areas, how dated our public health infrastructure is. And with that is how we're seeing the response play out from frontline healthcare workers not having access to proper personal protection equipment like masks and gloves and supplies, all the things that we need our health workers to have so that they could be safe to protect and take care of the rest of us. We see record number of misinformation out there, and whether it's the WhatsApp messages our parents might be getting on remedies to COVID-19, or just lots of social media and wrong information from places that look like they're genuine and accurate. And then there's a historical trust or lack of trust between communities and our healthcare system and our government. We know historically communities of color have bared the brunt of healthcare inequities. We know that lower income people living in urban environments and rural environments have already been left out of having access to quality healthcare and status of life. And we bring that into a pandemic where we're seeing those same communities who are out there working the jobs to operate society and grocery stores and buses and all of that, also bearing the brunt of getting sick. So I think we have like the operational issues that we're seeing that healthcare providers are having of communication, data, information. We're also seeing the trust and misinformation as an issue. And then the other, what I would say, is access. We have the supply chain issue that we all know, like, do we have enough vaccines right now? How on earth did we develop a vaccine so quickly? How is that possible? And leading to lots of questions of clinical trials take decades or tons of time. How on earth did we do this in such a short amount of time? All valid questions, all have answers. And there's been a lot of effort in communicating that process. And there's a lot of public access to a lot of those discussions that are happening. But still, there's lots of misinformation and like, how on earth could we do this? The other, I would say, as a Bangladeshi American whose parents immigrated just before I was born, language access is also another big barrier. Being able to communicate with a provider over phone or over these apps that we're seeing, senior citizens can't just register for a vaccine on the mobile device. There's so many layers to the challenges that we're seeing. And I know that there's also like lots of different people trying to find solutions and like we're trying to build a plane as we're flying it, I would say, even though the plane is a terrible analogy in a pandemic since we're trying not to travel. But as you can see, there's tons of challenges. In my work right now, I'm in the COVID response for my agency, and I work with societies that represent healthcare workers, and just hearing from frontline firefighters and EMS, people who have dealt with this, like from the very beginning, many of whom are now having access to vaccines, but saying, I already got COVID, I survived, so I want my fellow firefighter who needs it more than I do. So this like selflessness, even when you have access, is also occurring. Or I have a vaccine, now what? Can I go hug my kid? Or can I go see my mom that I haven't seen in a year? Like all these different unknowns. And if I could like leave one message, there's so many unknowns right now. We're still learning so much about this virus, and we have variants and all of that. But there's things that all of us, we can do. So wearing a mask, staying home, washing your hands, maintaining 6 feet of distance, those are all heroic actions. You are doing your part to protect yourself. You're doing your part to protect your family and your community. Whether you are in the categories in your jurisdiction to get a vaccine tomorrow or next month, there are still things that you can do now. And in that service, you're also protecting that healthcare worker who is risking their life showing up to work to protect you. So yeah, that's what I'd say.
Thank you so much for your thoughts on the challenges and situation. So the next question is for the whole panel. What can we learn from the pandemic about global inequalities, and how can we then better pursue global social justice?
It's hard to follow that. I just want to echo everything that you just said. And you said it so beautifully, but just to keep it short, I think that the pandemic, as you said, just shines a light on all of the underlying inequalities that our system has been allowing and continues to allow. And I think what we can learn from the pandemic, in my opinion, is everything is public health and everything is connected, whether it's housing, education, all of our social services, public safety, poverty, food insecurity, racism, people's mental health and sense of community and infrastructure. You know, it's just everything is connected, and we need bolder policies that address all of these things. And until those are not addressed, public health alone, CDC alone, whatever agency alone, can't solve this pandemic. This is more than just the virus. And so I think we just need, you know, from all sectors to come together. We need good governance. And I try to tell myself and others, like what you said, I think it's trying to build a plane as we fly it, or fly a plane as we build it, of like, we all have imposter syndrome, but we're all learning as we go. And yeah, I guess I'll say we just have to do our best and not give up the good fight, because it's not over soon. So we just got to keep on going. And like you said, we have to be heroes by just doing the small things that are actually big things.
Absolutely. I'll add 2 things here. It's been really interesting watching, especially with vaccinations and distribution. Just as I sit here in America, I don't have priority to get a vaccine just because I work at CDC. I'm privileged to be able to work from home. I definitely don't need it right now, but it's in our scope within the next few months that we would have some sort of access. But I know my family in Bangladesh, that's not even in the realm of possibility anytime soon, especially living outside of the capital, especially living in a rural space. And just seeing, I think I read a headline that high income and middle income countries have taken 70% of the supply out. Look it up, but it's some statistic like that. And we're just seeing, like, when push comes to shove, the access that we have as Americans, as this government, as the dollars that we have, we continue to protect the interests of the US first. And so that's really been just shocking to see in a health crisis, the inequality, just the people who already don't even have access to like a meal or education, or like just further going to exacerbate that. The other part about inequalities, sometimes when I look on my social media and I see my friends or colleagues going on the wonderful vacation to escape and going overseas or all of that, I know we all need a break and we definitely need to prioritize our health. But it doesn't have to be at the expense of importing risk to another community. Vacationing safely and all of that, I don't know. It just seeing that travel from an area like here to lower income environments, because tickets are cheap right now, and maybe finally like this vacation you wanted forever is now within reach, but then putting so many people at risk. That has just been such a stark thing I've noticed that bothers me. So on the inequality front, just those two issues is something that just, yeah, I think about a lot.
Yeah, oh, sorry, Kasia, do you want to go? Okay. Just adding on to everything that all the other panelists have said that have been so great. Just also, as Ariana said, like COVID-19 has exacerbated these global inequalities, not only shed a light. So I think acting with our community in mind, for example, the thing that we all did of staying at home, even though we were like young people or something, I think these are kinds of things that as a community of global citizens we can do, just acting with our community in mind, don't being, knowing that your actions matter and they have a bigger effect on a bigger community and a bigger society, whereas it is for the good or for the bad. And yeah, I think everything else has been said really great, so I don't want to add any more points to that.
One thing that I've been grappling with is this is a pandemic that has obviously impacted, all countries. Yet every country can manage it differently. So here in the UAE at this point, I think before a COVID patient even was presented in the UAE, we already started caregiver testing, patient testing, and this was in February. So to have that access available to anyone who wanted it so early on was amazing for this country. But then you see what's happening in others, and I feel like I grapple with, is that okay? Yes, it's awesome that this country has the resources to protect the people who are here. And they should rightfully be able to do that. It benefits me, it benefits our patients, and everyone who lives and works here. But how will we ever get to a point to where we're managing issues like this as a global society and not separate? And another interesting fact is that now I think at this point, the UAE is the second most vaccinated country, with Israel being the first. And again, I talked to my family back home, like, hey, have you been vaccinated? And they're like, we're not having a conversation about that yet. And so when I think about how we manage, thinking about inequities, I also grapple with, is it okay for a country that has the resources to protect its people to do so without lending those resources to other areas? And I don't know how we'll continue, the next pandemic or epidemic or global crisis that we face. If how we can get to the point to where we're making decisions as a global society rather than in silos as separate countries. And I think the other thing is that I hope, and I mentioned this earlier, that we don't allow history to repeat itself. And it's very easy for that to happen because the last time we had a major pandemic like this, many of those people may not be alive today. So how do we put the necessary processes and knowledge on paper so that it's accessible to the next generation, whether that's soon or not, for them to learn from the mistakes that we had and learn from the successes that we also had to aid them in managing a response. And I feel like we didn't do that as well this time for sure. Although the times are different 100%, but I just hope that we figure out a way to ensure that what we've taken away from this is utilized in the future.
Yeah, thank you so much for all your responses. Cache, I really like what you said about thinking about the future and having history not repeat itself. I feel like we don't consider that enough, or at least address it appropriately. So our next question for all of you is also like for everyone, kind of shifting back to the needs of the community that you work in, like moving forward with this pandemic response, like what are those needs that should be addressed and still need to be addressed? And more so, in what ways can our community, the GSP community, like in Ann Arbor or the University of Michigan community, how can we help?
One thing that I think still needs to be addressed here is health literacy. This country is fairly young. It was established in 1971, but is extremely resource rich. And with that comes a number of different challenges. You have, the best doctors, some of the best care that you can receive, but your knowledge of how to protect your health and how your social life and behaviors impact that still isn't as developed as it is in the US. And I think it's something that we need to focus on. For example, we have patients coming to the hospital with a headache asking for the neurosurgeon, or we get chronic patients with chronic diseases who don't have a primary care provider and don't even know what the concept of that is. And I think we, although having the resources and the capability and the access is amazing, need to focus more on public health and teaching people about how their behaviors can contribute to worsened health outcomes. And it's interesting to be in a place that has so many resources, but it's still developing that. So I think that's one thing that still needs to be unveiled for this community. And I definitely think that with folks in GSP coming here to volunteer, being involved in global organizations like many of the other panelists are is definitely impactful because it allows not only folks from the US or the UK or anywhere else to come here and provide learnings from their healthcare systems, but everyone from around the world to give their feedback. And I think that's one thing that the UAE really has going in its favor, as 80% of the country is expats and we have hundreds of nationalities represented here. So it really presents a great opportunity for education and community involvement when it comes to healthcare.
We're going to offer kind of a different response, thinking about community beyond my professional lens. I think one of the things that I've been grappling with in the pandemic has been in the need for social distancing, how much we've disconnected as a community and as a society. One of the things early on when contactless delivery was the fresh implemented, I was talking to my husband. I'm like, you know, we already don't see the people making our food, and now the person who's literally bringing it to our door, we don't even get to say thank you or get to see. And obviously, yes, 100% support the public health side of why we need to practice distancing. But the other part is how disconnected we can be from even the person living next door or who's sitting in the cubicle down the hallway. And we're seeing that this pandemic has really flipped on its head our societal expectations of what productivity mean, what working around the clock. We're pretty much a workaholic society in the US who only highly values putting in the hours into your job. But what we're seeing is that gendered responsibilities are further exacerbating. We're losing women from the workforce, our homes, our children, our families are all suffering, our friendships are all suffering. So one of the things moving forward, this pandemic at least has shown me how much I really need to do better in being present in my relationships and being present in my family. I am one of the hundreds, if not thousands of people who got married in a pandemic. My husband and I had a very small backyard wedding, different than what we ever imagined it to be. But it has really shown that, one, you can get struck with a disease and die instantly, or you can be on a ventilator and not even be able to hold the person's hand that means so much to you, or that teacher in an instant who you didn't get to talk to, been meaning to talk to, is gone. So this pandemic has really shaken that at my core of being more present in my relationships and putting more effort into myself and what it means to have a better society and more equitable society. And outside of the job that I do that I'm very passionate about, what else can I do and what does it mean to be a contributing member of community and society. So I will say, moving forward, I hope everyone doesn't feel guilty about taking care of themselves, having joy in this chaotic world that we're having. It's okay. You should be happy. It's okay to be happy and find joy. It's okay to turn off the news and just not look at the statistics on death counts and hospitalizations anymore. It's okay to tune those things out and take care of yourself and not feel any guilt about it. At the end of the day, it's not about the emails you've written or how many promotions you've gotten. It's, did you have that moment with your family member? Did you get to have that conversation that you wanted? So I have a lot of accountability partners in this. Those hobbies that I wanted to do, I need to make time for these things. So that I hope as a society, we really reevaluate how we value each other, and it's not jobs and titles and what we're doing as outputs, but what it really means to be a person and a citizen and a human. So that's my takeaway.
I just want to echo about being more present in your relationships and for yourself. I was at home for 10 months with my family, and it was such a beautiful time with them. And I just got back 3 weeks ago. And yeah, it's also made me reconsider, like, what is it that brings me joy? I'm always searching for something new, a different challenge, a different country, whatever it is. And I just am realizing that that joy comes from within. But yeah, I just wanted to say that before I say what I had originally planned on saying. So what I originally planned on saying as a data person, and I work a lot with data, I feel a little bit, disconnected from the humans behind the data. And I feel like we as a society have been becoming disconnected from the human lives behind the data. I mean, every day, like Mahmoud said, we're looking at, death statistics and hospitalization data. And it's just like, each and every single person, we say, oh, it's decreased. Okay, but it's still human lives. And so I think what needs to be addressed is just remembering that and realizing that even if a number of deaths has decreased in DC or whatever it may be, who is not dying still? Who are those people and why are they disproportionately affected and what can we do about it? Instead of just seeing a little graph and saying, wow, success. It's more than that. And so that's something that I try to remind myself every day of in my own work. And I think as a society, we need to keep reminding ourselves of that. In terms of specific needs in South Africa, something I've been thinking a lot about is stigma and misinformation. Specifically around stigma, I just want to give a quick example, a quick story. So I have a friend who went to a wedding, a very large wedding, and he was the only one that was wearing a mask. And then a few days later, he got tested and was positive for COVID. And then he told the groom and, you know, any of his friends that were there. But then from there on, nobody else was notified. And I'm after realizing that and just thinking about, you know, general stigma within the community, we need to reduce the feelings of blame and shame around having the virus. And because if we don't, it's going to be so much harder to address the ongoing spread. If people don't, if they have it and they don't tell the person that they saw 2 days ago, how can we do effective contact tracing? It's impossible. And so if we don't address the stigma, it's going to be really difficult. And it continues to be difficult. And then misinformation, I'll just echo what was said before, but just the misinformation around masks and now with the vaccine. I've also been hearing a lot in South Africa, there's no way that a COVID vaccine is real after being developed in a year when an HIV vaccine has never been developed, even though it's a completely different virus. There's so much, you know, it's completely different, but just things like that, or like the 5G, I don't even know, conspiracy theories being spread, just things like this. And it's so hard to trust what you're reading. And that leads me into the second part, which is what can our community do? I would say lead by example, stay educated, and try to be a critical thinker when absorbing any piece of information. Everything you say, whether it's to a friend and you're just chatting, whether it's to your family member, everything we say and everything we do has a ripple effect. So I urge everyone to have a positive ripple effect and just make sure that you're spreading accurate and helpful information.
Thank you, everyone. Yeah, just going off from what Momo said on the gender also effects on this, I'm just so excited to be on an all-woman panel. And I don't think I noticed until Momo said that. So yay for that. And I guess for me, at least, I'm not in the public health sector. So for me, at least in terms of like refugees and migration and all of this, COVID again has not changed any of the context that force people to run away from their country of origin, to seek asylum, to seek safety. So if anything, the world's, I think it's 79.5 million refugees and forcibly displaced people has only made them more vulnerable and exposed. So echoing kind of like what all of you have said, and what kind of Moon said on what it means to be a person and a citizen, I think the spreading of information, of hate, of xenophobia and everything, I think that's one of the biggest things that I see, at least for the refugee crisis. Fighting xenophobia in countries, hosting countries that have provided a shelter and anything, but a lot of a lot of the challenges that we face with migration sometimes is that local population have a lot of like misinformation on what refugees are, or on I don't know, like for example, for COVID, like what does that mean for new people to come into the country or anything. So I think that like ripple effect that Ariana was talking about on the spreading of information, and also becoming just good citizens and good people, and just spreading this like feeling of love and community towards people that are not from our own country. I think it's so important, especially with this pandemic. Other than that, just like just ensuring that you are one of those people that like allows access to these marginalized communities, allows access to medical services, to basic necessities, to anything that they're being deprived of and that have continued to be vulnerable and exposed to. For example, my UNHCR is already assisting in this task, but I don't think it's like I don't think it can be handled only at the top-down level. I think it starts from our families, it starts from our treatment with friends, it starts from everything. So I think we all have a part in that, and hopefully that can have a ripple effect, as Ariana says, and like on the good run.
Thank you once again for your thoughts on this question. We did have one more planned question, but we want to make sure we've gotten a couple Q&A questions that have come in. So we wanted to start the Q&A portion to give the community time to ask any questions that they would like to. So I'm going to start by asking the first Q&A question from Michaela Minnis. It says, hi GSP alumnus. I am a third year student at U of M and second year member of GSP. I am interested in public health, public policy, and women's studies specific to reproductive health and justice. I would love to hear your advice about caring for yourself in the work you do, which can be emotionally taxing, and staying true to your values and beliefs in the workplace where those beliefs can come in conflict with the progress you want to see in the world.
That's such a great question, and so much in one question. The first thing that came to mind is for the longest, I think even in graduate school, even when I started working, I had severe imposter syndrome. All along the way, I kept thinking, oh my gosh, everyone is smarter than me, everyone is older than me. Being one of the youngest people in an office or in an environment all the time can really make you think that like I don't know what I'm doing. But I will say that I don't know, I see someone in the chat, but I don't know if it's the right Chineri from U of M School of Public Health. But one advice she gave to me when I was in graduate school, and I was thinking about applying for something, I think it was some funding or something, and she's like, did you apply? I said, no, I don't think I'll get it. I don't think I'm like a strong enough applicant. And she said, why does that matter? Your job is to put yourself out there and apply, and whether you're accepted or rejected, it's not you. It's up to whoever. You don't have to worry about that. Just put yourself out there. And I have repeated that dialogue in my head throughout then, like since graduate school to where I am now. And I think it's a good reminder that you do know what you're doing. You're not ever expected to know 100% of everything. One of the best skills in life, I think, is not to be afraid to ask questions and have humility and not knowing and just being honest about that. So as a woman of color, as a young person, I don't know, this audience is a lot younger than I, but I consider myself young still. But I will say that even when you're doubting yourself, like know that you are there for a reason. You were invited or welcomed, or you just showed up, even if that door wasn't open, for a purpose. And remember those values that are important to you. And sometimes it is really hard when you can be environments where your values come in conflict with what is happening. That I think Ariana alluded to that earlier. Sometimes, and Cache, like having the humility to reflect on yourself, like maybe there's something that I can learn here, or having alliances so that you can have another voice to bring with you to like express what you're doing. Sometimes sometimes especially pushing for equity and justice might be the quieter voice in the room when there's like dominant powers, but it's still an important voice to bring to the table. And it is absolutely emotionally taxing, the work that we do, the pandemic that we're living in, all of that. And it's really important to take care of yourself, whether that is getting a therapist and speaking to a professional. There's no shame at all in this day in taking care of your mental health from a professional, whether it is doing things that bring you joy, that's just yours. For me, it is making cha like my mom does and just enjoying that full dark black cha with the powdered milk and sugar. That makes me happy and I'm gonna have it. Or it's relying on your support system. And I have a great husband who doesn't bicker about me working late into the evening, but is there to knock on the door and be like, hey, I have a bowl of fruit. So being able to like accept kindness that others are showing towards you and finding joy. Do all of those things. Be selfish to take care of your mental health, your emotional health. Make time to have fun and fall in love and all of those things. Professional life is going to be there. Pursue those pursuits. But if you're not happy, if you're not good, nothing else is going to fall in line or work out. That is what I'll say from my soapbox right here.
I honestly have nothing else to share after that. You summed it up.
Me either. Just want to echo, find joy and get a therapist.
Yeah, me too. I guess like one only thing that I could add is like, as an individual, I think your work is going to be more proactive if you are happy and you are relaxed and everything, especially with the work that we do, that it's so, like, as you say, emotionally taxing. I think, at least for me, I find that I become more productive. I'm way better at my job when I feel confident and I feel relaxed. And that way I feel like I can make a bigger effect on the positive side to the people that I'm trying to help. Other than that, I echo everything that everyone said.
Yeah, thank you so much. That was really cool and very encouraging to hear. So we have another question, and this one is from just someone in the audience. We don't know who, but it's for Cache. And they have said, my parents have made arrangements to go to Dubai in April to get vaccinated. What are your thoughts on vaccine tourism? Do you think it should be permitted, given that there are still many at-risk individuals around the world who need to get vaccinated yet won't get access to it until way later into the year?
That is a complex question. I think from what I've seen recently, I think it's wrong to sell it and promote it in some of the ways that I've seen. One of them is like a tour. You get to spend 10 days in this country. We'll take you around. And then along the way, you'll get your vaccine shot. And I saw another one like beach mojitos and get the shot. And I just was flabbergasted that it was promoted in such a nonchalant way. And then these tour groups and companies, charge thousands of dollars to take you around. And I don't necessarily think that it's appropriate to try to make profit off of this. I do, and I appreciate countries for prioritizing it as well. So here, for example, we just started this initiative, I think early February for the next 6 weeks, that we're prioritizing it for the elderly, for those with chronic conditions, and only for citizens and residents for this time period. So if it's available in another country and someone has the means to get it from there, I don't know what could stop that. And all I can say is that I hope the countries that are providing this, mine included, is taking care of their citizens and doing their part in providing additional resources to other countries that can't support it. But we see this also with medical tourism, in a general sense with surgeries that, perhaps isn't offered. And then those that have the money can arrange, flights and care and hotels to be in another country for months to get the care that they need. And I think it's a tough ethical question, and it pulls on your values. But I do think that it's nice for a country to be able to allow other people access to that if they can reach it, if they've taken care of the citizens or residents within their country.
Thank you so much for your thoughts. We have one last Q&A question that I believe we have time for, but maybe not time for all panelists to answer. It's from Annabella Fritz. Says, hi, this may be a complex question, but I keep thinking about how someone said that not a single source / organization / branch of government, etc., can solve this crisis. As someone who studies climate science, I keep thinking about how climate change will increase occurrences of disease in ways we don't understand yet. I was wondering if there has been a collaboration between public health workers, environmental activists, and geoscientists in current efforts, or if there have been discussions about doing this in the future.
I can take that one. I'll say that as we were talking about like this COVID response earlier, that no one central agency can be the one all be all end all for anything. Speaking from CDC, most of our work is in partnership with state health departments, ministries of health, international governments, other agencies, partner organizations, all of that stuff. And I would say the effects of climate and environmental health, it is definitely a collaboration across all of these sectors. And just from the portfolio that I work on is global health, but we have nonprofit organizations as a partner, we have private sector, we have international governments, all of that. So I imagine similarly in climate change and environmental health, that those cross-sector collaborations all exist. Whether you're setting the policy or you're implementing a policy as a regulatory body, or implementing it as a manufacturer or someone creating products, we all have different responsibilities to achieve common goals that has a lot of buy-in when implementing. And Mayumi, you can probably speak to that from your experience at UNHCR and all the different sector players that come in to address issues.
Yeah, I guess like I don't have anything to add other than that point. Like I believe like at least for UNHCR, like what I've seen is all sectors unite in terms of this common goal. Like we have partners who are in the legal services, partners who are in only medical services, shelters, everything, and everyone has become extremely essential into building this like common one goal, because nobody can know everything and nobody can fix everything. Not a single person and not a single organization can do that. So I guess like one thing that this pandemic has brought, I guess, like is this common goal that we're all in this together in reality, because there's not a single country who hasn't been affected. There are differences in like the inequalities that it has faced, especially for like economic advantages and everything that certain people have managed to gain access to better healthcare or something. But other than that, I think like, yeah, that's like, yeah, we're all in this together and we can all put our little grain of sand into making this common goal be reached.
Thank you so much, everyone. Amanda and Varsha, so thank you so much for co-hosting today. And to our panelists, Mayumi, Kashay, Ariana, and Munmun, we so appreciate you being with us today to share your perspectives, experiences, and expertise with the GSP community and the broader University of Michigan campus. It really meant a lot to us, and we're so grateful to you. I also want to thank the GSP staff, Ashley and Nita, Mandy for captioning. Thank you so much. Thank you to all of our students and student leaders who joined us. Thank you everyone who participated today. We look forward to seeing you again at another Global Citizenship in Practice event. Until then, please take good care and see you next time. Thanks a lot.